Hi everyone, welcome to Medstar Health Mondays on Bascom TV. I'm Brian Kaplan, Regional Director for Medstar Health Physical Therapy and your Physical Therapy Liaison for Bascom Football Leadership Academy. Today I wanted to talk a little bit about use of masks and gloves, especially with everything going on in the world right now with this pandemic. It's very important that we have a really good understanding of how to utilize your gloves and masks appropriately to keep you safe and to keep others safe. The first thing with putting on gloves is to make sure that your hands are obviously clean at first. What I like to do when I go out in public to a restaurant or pick up food or to a grocery store is to make sure that I don't put my gloves on until I get there, and I want to make sure I'm touching as little things as I possibly can. In my car, my wife and I keep a plastic bag filled with gloves that we know that are clean. If you have a box of gloves, it's fine to keep that as well. When you arrive at the grocery store, for example, the first thing you're going to do is go ahead and get out of your car. Once you get out of your car, you can place your gloves on. You want to make sure that your hands are clean. If you have alcohol, Purell, some sort of wipe in your car, it's good to wipe your hands down first. And then when you place your hand in the glove, you want to make sure that you place your hand all the way inside of the glove, kind of holding the bottom, but try not to touch it as much as you can unless your hands are really clean, because you don't want to contaminate the glove. I think a big misnomer out there is that because I have gloves on, I can't contaminate things, and that's really not true. Whatever you have on your hand, say for example you had some sort of COVID on your hand that you don't know about, when you go and touch the glove, now the glove has been contaminated. You walk into the store, you go ahead and touch something on the shelf, and then you don't want it, you leave it on the shelf, now you just contaminated an item, and that's called cross-contamination. So we want to make sure we're avoiding that. So just be really mindful once you have your gloves on, or even without gloves, what you're touching and how much you're touching, okay? So now I have my gloves on, I go through the grocery store, I do my encounter, I touch all the things that I want to touch, I put them in my cart. Now here's the question. When you get to your wallet, what happens with your credit card, right? Because now you were in the store and you touched a lot of different items that may or may not have anything on it. So what I've started to do is when I go to the grocery store, I usually keep one glove on and one glove off. I keep my hand with no glove in my pocket, so I don't usually touch anything with that. And then I utilize this hand to open doors, to push the cart, to grab things. That way I know I have one hand that can be contaminated and another hand that cannot. When I get to the end, I put all my groceries on the line, and then when I go to pay, I utilize this hand to reach into my pocket. Most times now what I do is I take my credit card out already and have it ready to go in my pocket. I take my credit card, I'll usually touch it on the register. I don't usually like to hand it to the clerk, but if I do hand it to the clerk, I'm mindful of that. If I do hand it to the clerk, then I'll take it back with my gloved hand, and then I'll usually kind of try to hang on to that until I get back to my car. So the biggest thing that I see with people with their gloves is that they utilize the gloves for more than one encounter. So after you've gone through the grocery store and you've touched everything, the best thing to do is get back to your car. You can put the grocery bags into your car, but you also want to make sure that whatever hand that you're using to open the doorknob or push the lever on your trunk is a clean hand, right? That's why I said sometimes I like to just use one glove and no gloves, so I know one hand is always going to be clean and the other hand is the contaminated one. And then once I've gotten everything into my car with my clean hand, I'm going to take this glove off. I'll walk back to the grocery store, I'll push the cart with me, and then when I take the glove off, it's important that you're not touching anywhere on the glove. So the best way to take the glove off is to reach up underneath here, like that, and pull it up so that your fingers are underneath the glove. That way your fingers are not touching any part of a contaminated glove. You're going to peel the glove back this way, that way your hand's never touching it, and if you touch the inside, that's okay, because that's clean, and that's what we're going to throw into the garbage. So I think that's a really important thing that I've seen or encountered. I see a lot of people that have gloves on, go to the grocery store, for example, get right into their car, open their car door, get in the steering wheel, and they're holding it with those gloves that were contaminated. Now you contaminated that area, and now you're in your car and you decide, oh, I need to call somebody or text somebody. You reach into your pocket, you take your phone out, you've contaminated that. So I think it's really important that you're just thinking, what did I just touch, and then what did I touch after that? I think if you can start thinking ahead, it takes a little bit of planning. Again, like I said, the first time I went to the grocery store, I had two gloves on, and then I realized that wasn't going to work when I got to the register. Another place that's somewhere good to think about is when you're pumping gasoline. I'll get out of the car to go to pump gasoline. The first thing you have to do is you have to push the buttons on the machine. Same thing at an ATM. You want to recognize that people all day are touching those things, some with gloves, which may or may not be contaminated, some with hands, which may or not be contaminated. And they're not usually wiping those things down very frequently. So I think it's very important, again, to plan ahead. That's the biggest picture. If you don't get anything out of this talk, start thinking and planning ahead, right? So you don't want to just touch something. So again, at the gas station, I'm going to go, I take one hand, I put my glove in, I push all the buttons, I take the pump. Again, the gas pump is also something that's pretty contaminated and not wiped down. I do my interaction there, and then I take the glove off. Again, gloves are for one interaction. You don't want to utilize them for multiple interactions in a row or multiple episodes in a row, because you're just contaminating that and other things. So please, again, be overly mindful of that. The other thing to think about is your mask as well. So when you're placing a mask on, you want to make sure that you're not touching anywhere on the inside of your mask or anything of that nature that's going to be contaminated. Again, before you put your mask on or take your mask off, make sure that your hands are clean. Again, wash them with soap and water for 20 seconds. If you don't have that availability, you want to use some sort of alcohol that's probably at least 70%. So placing the mask on, I'm going to hold at both ears, place it over my nose and mouth, and now it's covered. What I see is a lot of people with their masks on. I know it's not very comfortable. A lot of people kind of touching it and kind of adjusting things like that. You know, again, it's okay to touch the outside of your mask, keeping in mind you want to have a clean hand when you do that. When you go ahead and take the mask off, similar procedure. You want to make sure that you're touching the outside of the mask or the ear part to pull down. Don't reach in and touch it with your hand. And go ahead and place your mask in a location that's going to be clean and secure. I see a lot of people just hanging it from the rearview mirror of their car or letting it dangle in the car seat. Again, you don't recognize what contamination you're bringing in or out of that car. So I think it's really important, again, to plan ahead and think, is this a safe space? Is this a clean space? If you guys have any further questions regarding masks or gloves, please feel free to reach out to us. You can email us through our Medstar email addresses, and we're happy to help with any issues that you're having. Again, I hope this was helpful. It's really important that we're aware of how to utilize our masks and our gloves. I hope that was a really helpful overview of how to utilize your mask and your gloves safely. Again, think about contamination. Once you touch something with those gloves, with those hands, it's contaminated. So you can't go ahead and touch multiple things unless you're going to go ahead and clean or change. So it's important to change those gloves. It's important to clean your mask every couple of days. Make sure if you have anything visibly on it, if there's anything soiled on a mask or gloves, you want to remove them and change them or clean them immediately. But hand hygiene is always going to be the most important thing in preventing this disease right now. This is what we know. Washing your hands is the best way to kill that virus. Using alcohol is another great way to do that, and making sure that we're avoiding touching our nose or our mouth or our eyes or our ears with any sort of contamination on your hands. Everybody have a good day and be safe.
Hi, my name is Heather Kohlbus and I'm athletic trainer with Medstar Health. My contract is with the Baltimore Blast professional indoor soccer team. My role with them is to provide athletic training services in such that I take care of taping their ankles, providing point of contact for all of their medical care, and coordination of anything that they need in regards to their health and well-being as an athlete. I've been with the team for about 6 years, and before that I started out as an athletic trainer for 15 years in the public high schools. Went back and worked in my alma mater, North Hartford, which was an awesome gig for me at the time. And then when the contract came up for the Baltimore Blast, I said I'm ready to go and do this with them. I had a little bit of a background in high school and college as a soccer player, and that brought me into the athletic training program. I was interested in being part of the sporting community, but not necessarily in a coaching capacity. I also felt that I wanted to go into medicine, and emergency department was probably where I would end up going. But when I found out about athletic training as a career, it merged both of those loves together. Dealing with an emergency situation and also dealing with sports setting and making sure that athletes are able to do what they want to do in a safe environment. It always gives me a good feeling of being an athletic trainer. We're always behind the scenes. You won't see me at a game. Hopefully you'll never see me at a game when I'm working with the Blast. I like to stay behind the bench and make sure that everybody's doing what they need to do.
Hey everyone, this is Amber Radke, athletic trainer with Medstar Health. Today I'm bringing you an at-home agility workout. So we just created with chalk on the sidewalk here a ladder with 11 rungs about a foot apart. We're going to take you through about 14 exercises and show you how to do some agility at home. Alright everybody, we're starting with 2 feet in. So 2 feet each one. You can turn around and come back, or you can try your hand and come backwards. Okay, now we're going to do 2 feet down the side. Keep your arms pumping as fast as you can. Now you're going this way, facing the same direction. Working both sides of your body. Double leg high. Like a bunny rabbit. Because it was just Easter. I have 2 bunny rabbits in my yard. Alright, now we're just doing 1 foot in each box. So it looks like this. Should be much faster. Now we're going to skip a box. So 1 foot in. Skip. Okay. Woo! Now single leg hop. On my right foot. Go back on the left foot. Uphill. Alright, here we go. We're starting with the Icky Shuffle. You start on the outside. 2 feet in, 1 foot out. 1 foot out. 2 feet in, out. In, out. Once you get the movement, you can go a little faster. Ooh, I just messed it up. I messed it up again. It's okay. What do you do? 2 feet in, 2 feet out. Get your arms pumping. Hang on your feet. Whoop. I messed it up again. Just keep going. Now we're doing an ski jump. So, like you're skiing. Or you can go on one side of it. Like this. Alright, now we're going to do some high knees. So get your knees up nice and high. You can do 1 foot in, or 2 feet in each if you want. That'll take you a little longer. Okay, now we're going to do lateral high knees. Same thing. Face this direction, go the other way. Now we're going to do karaoke. This way. Now we're going to do switch feet like scissors. Okay. Whoop. So both feet should go into each box. Go. So what you're going to do is you're going to do each of these things kind of slow the first time through and then pick up speed as you get more comfortable with the movements. So start out 1, 2 times and then pick up speed and do the circuit 3 to 5 times depending on your fitness level. So this time we're getting our ball back out. We're going to do some core over moves, so just inside tap. Okay, we're going to do that for a minute, see how many taps you can get. Don't forget to tag us at Medstar Health. taps. I know you guys can do better than me, so let's go ahead and see what you got.